Hello and welcome back. I am Ashok Rajguru, your tutor, and in this video I shall be reading out a case of multiple sclerosis. The objective of this video is understanding the case as described by the doctor. Let me first acknowledge my thanks to the doctor who has presented this case on his website, and it has helped me tremendously to develop this video to point out how we can work with this case using first principles of homeopathy. So the doctor I wish to thank is Dr. Jaswant Patil, and as you can see from his qualifications, he is an allopathic doctor, MBBS, and an MD with a chest specialization. His biography is a very interesting story. He was a very successful allopath with his specialization in chest disease. However, some incidents in his life showed to him the inadequacies of allopathic practice, and he turned to homeopathy, not just as a curious bystander, but he took a sabbatical and undertook a full-fledged bachelor's program in homeopathic medicine and surgery. Today, he has a very successful practice in Mumbai. He has his own clinic which offers many modalities of healing in addition to homeopathy. He combines homeopathy with the best of traditional Chinese medicine, Ayurveda, and many other alternative therapies for the benefits of the patient. So he is not at all a dogmatic man, very open-minded, but his mainstay of practice is homeopathy. Here is a picture of Dr. Patil with the US President Obama. I'm sure you can guess who is Dr. Patil in this picture. Now, the patient. The patient who came to him was a 25-year-old female, married. She was a housewife and she had one son. She was diagnosed with multiple sclerosis. I'm using the word diagnosed because that is not the word or the label attached by Dr. Patil. The patient came to Dr. Patil with certain MRI reports after she had seen a number of allopaths, and that is the term we are using in this particular case. Here is a list of symptoms. She had loss of sensitivity in her limbs and her muscles were very weak. She used to get muscular spasms and had difficulty moving around. She also had difficulties with coordination and balance. In fact, for the last 4 days before she saw Dr. Patil, she could not balance herself while walking and she needed assistance. She could not speak properly and she had difficulty in swallowing. Also, she used to get tired very easily. Continuing with the symptoms, she could not control her urine or stools. She also had severe nausea and vomiting, which increased every time she moved around or changed her position. She had also been experiencing giddiness for the last 1 month. Also, her mind seemed to be quite dull and she could not comprehend simple things. Sometimes she was also delirious. Her symptoms were worse during and after sleep. They were aggravated by heat and better by cold things or cold environment. She had a diminished appetite, an increased thirst, and also she had been suffering from constipation for quite some time. She always felt drowsy and was having frightful dreams. So in this video, we saw a summary of the symptoms presented by the patient. Thank you very much and see you soon.